Progeria comes from the Greek word progerios, which means prematurely old. Progeria affects an estimated 1 in 8 million U.S. births, but only 1 in 4 million cases are reported. Since it was first documented in 1886 by Hutchinson, more than 100 cases worldwide have been reported. Claims picture. Research shows that boys are affected 1.5 more times than girls, and 97% of the individuals affected are Caucasian.
Hutchinson-Gilford Progeria syndrome received its name from the doctors who first reported the disease. Dr. Hutchinson first reported HGPS in 1886, followed by Dr. Gilford in 1897.
In Hutchinson's case study, a 3-year-old boy was described as having a particular old mannish look. He went on to note that the young boy had a prominent head and was lacking hair. His skin was tight and semi-transparent. He was also thin and smaller than average.
Retardation, little or no hair, large eyes, large head, and small chin are a result of Hutchinson-Gilford Progeria syndrome. Individuals affected by HGPS don't always exhibit these traits. When first born, they appear to be completely normal. Usually 1 to 2 years after birth, inhibited growth begins to take place. Craniofacial disproportion, balding, bulging scalp veins, and skin changes follow. Stiff joints and dislocation of bones, which are usually associated with old age, are common among individuals with HGPS. Death typically occurs around the age of 13, usually from cardiovascular disease.
3. Researchers discovered that children with HGPS share a common de novo dominant mutation. The LMNA gene is responsible for the production of lamina A and C proteins that provide cell stability. Patients with progeria have a mutation in the lamina A protein that causes lamina A to build up inside a cell structure instead of being properly used.
The lamina A protein is found in most of the body's cells. Over time, the buildup of lamina A inside the cell's nuclear envelope causes distortion in the cellular structure and loss of function of these cells. This weakens the cells and causes premature aging and early death. In patients with HGPS, this cellular instability causes tissues to age prematurely, leading to the advanced aging common in progeria.
Hutchinson-Gilford Progeria syndrome, or HGPS, was diagnosed in the past by observing the symptoms and the child. As a newborn, the child would usually appear normal, but by the time the infant had reached 1 year of age, their growth rate would start to slow. Soon they became shorter and lighter than the children their age. When the doctors observed their symptoms, they would often misdiagnose the child with a variety of other diseases. When the doctor would notice that the child's symptoms were the symptoms that are normally related to old age, they would then turn to HGPS.
Diagnosing HGPS has become much simpler. Scientists have discovered that HGPS is usually related to the change of one letter in the billions that make up DNA, and have created a diagnostic test. The diagnostic test decodes the gene sequence letter by letter to find the one that has created this rare disease. This discovery has led to fewer misdiagnoses and earlier medical interventions that could prolong and better ensure the quality of life for these children.
Rosen-Gartington, McKenna, Grochova, and Erickson have discovered that progeria leads to a decreased epidermal population of adult stem cells and impaired wound healing in mice, which is what gives the skin an aged look. They performed a study showing that the progeria skin phenotype was reversible to some extent.
Rosen-Gartington, McKenna, Hurwacz, and Erickson took progeria-induced mice and used a labeled retaining technique to identify the number of stem cells in their skin. They analyzed dorsal skin following a 70-day chase period and found that there was a significant reduction in label-retaining cells in the progeria mice than in the normal mice. They discovered a way to reverse the progenitor cell characteristics, although they reversed what was causing the decrease in epidermal population of adult stem cells. The expression of the progeria mutation caused damaging effects to the adult stem cells that were present.
Another group of researchers has begun using progeria-induced mice to find possible treatments for Hutchinson-Gilford Progeria syndrome. They have found that FTIs can reverse the abnormally shaped nuclei that is characteristic of progeria.
FTIs are a class of drug that was originally developed for treating cancer and are capable of reversing nuclear structure abnormalities. Even though progeria is not cancer, this drug has proven to be promising in the treatment of HGPS. The Progeria Research Foundation is preparing for a clinical trial using FTIs to treat children with known progeria. The Research Foundation will begin by giving each child FTIs twice a day in pill form and observe for slowing of progression or reversal of the abnormally shaped nuclei in the children. Although FTIs have some side effects such as diarrhea and changes in blood tests of liver function, researchers in the Progeria Research Foundation are hopeful that this could be the next big discovery in progeria research.
Since Dr. Jonathan Hutchinson first discovered Hutchinson-Gilford Progeria syndrome in 1886 and Dr. Hastings-Gilford documented HGPS in 1897, great strides have been made towards better quality of life and treatment for the children diagnosed today with this disease. Scientists have found the source of the HGPS, a de novo dominant mutation in the LMNA gene, and figured out how to induce progeria in mice, which researchers are using to test possible treatments for Hutchinson-Gilford Progeria syndrome.
Using those mice, researchers have found the first promising treatment for HGPS, FTIs. The Progeria Research Foundation has started preparing for the clinical trials using FTIs, and for the first time in centuries, children diagnosed with Hutchinson-Gilford Progeria syndrome have hope for a cure. Scientists are well on their way to discovering a cure for this rare and fatal genetic disease and possibly a cure for aging altogether.